Important information for anyone who has a child in the car. The advice doctors have been giving parents for years is changing.
CBS 19's Field Sutton joins us from South Tyler. Field, there's a lot to keep in mind when you strap your child in for the ride.
And Brian and Michelle, a lot of it is common sense. Now, when you're getting a new child safety seat, the number one thing you want to keep in mind is read those directions. Make sure you understand everything they say, because there's a lot of things that go into the design, things you'll need to keep in mind when you strap it in for the first time. And you do want to make sure that it's strapped in tightly to the seat. Make sure it's not going to go anywhere in case you do get in a wreck. Also, you want to make sure on younger children's seats, these harnesses are really working properly, because that's what spreads the force of an impact out and make sure those tiny little bodies don't get any more hurt than they absolutely have to if the worst happens. Now, the other thing you want to know, though, is that doctors now say that when you've got those younger children in those seats like this, you want to make sure that they stay facing backwards until they're 2 years old. Keeping a newborn safe can be nerve-wracking.
And they had a safety class on how to use a car seat at the hospital before I brought her home.
2.5 years later, Celie Coleman says she still can't stop looking into the rearview mirror to make sure her daughter's safe. But it's easier now that Rhiannon gets to face the front.
She's 2.5, and I changed her when she was 25 pounds or a year.
Until recently, 1 year was pretty standard. Now the American Association of Pediatricians says you should wait an extra year, and that gives young children the time to form critical muscles that stop their heads from moving violently forward during a crash.
The new recommendations are guidelines. They're not.
Dr. Kenneth Helmer is a trauma surgeon at Mother Frances Hospital. He says parents have to use their best judgment when it comes to following the new guidelines. Some children just grow too fast for those small seats.
They would have been really constrained in the car seat to be backwards facing for that long.
Amy Mark weighed her options.
You almost got it.
As her children hit their first birthdays, she turned them toward the front of the car not long after. It's not an easy decision. Car wrecks are the #1 cause of death for children, not to mention the injuries.
The worst of those that we sometimes see as well is brain injury or neck injuries.
Helmer says he agrees with the other half of the new recommendations. Older children should stay in a booster seat until they're 12 years old or 4'9", whichever comes first. And before then, a seat belt designed for adults can do more harm than good.
Where'd you go now?
It's a rule Efren Rodriguez has already explained to his son.
It means my life, so he's my life, and always we try to follow.
Now, it is possible to overdo it when it comes to safety. Whatever kind of seat you're using, you want to make sure that you follow the directions when it comes to the weight. Now, this one is designed for children who are 30 pounds to 100 pounds. You just never want to overload the seat for anything more than it's designed for. That could be asking for a lot of troubles down the road. In Tyler, Smith County, Field Sutton, KYTX, CBS 19 News.
All right, Phil, thank you very much. Now, to see those recommendations again, you can log on to CBS19.tv and click on the hot button.